Welcome, everybody. Very excited to have you all here on our national call this Tuesday night, or night for me at any rate, probably not night for most of you. And we have a guest speaker tonight talking on the health effects of climate change, and I will introduce her very shortly. In the meanwhile, if you hover down at the bottom of your screen, there's a chat box where you can chat, you can put in links, etc. And if you have questions, we're going to have a nice question and answer period at the end, and put the questions in the Q&A box. Just enter it in there and we'll get to as many questions as we possibly can. And with that, I'm going to introduce our speaker for tonight. Our speaker is Frances Stewart, who is a psychiatrist, an integrative health coach, and a retired U.S. Navy captain. She's been a practicing physician for 38 years, graduated from the West Virginia School of Medicine, and did postdoc training at WVU and the University of Vermont. She served as on the faculty at University of Vermont and the Uniformed Services University of Health Sciences. She had retired from her position at the National Untitled Center of Excellence in Bethesda in 2018 and continues to serve as a volunteer physician with the American Red Cross and the Maryland Medical Reserve Corps. She's continuing in research work in collaboration with investigators from Uniformed Services University, Harvard University, and Emory University. Frances also serves as a climate ambassador for Physicians for Social Responsibility and a Climate for Health ambassador for Eco America. The best to last, Frances is a very active member of Elders Climate Action and several other climate-related organizations, and she's working to solve the climate crisis. Frances is a key volunteer for the Elders Promote the Vote project and very active on several of the other ECA national committees. And we are overjoyed that Frances has chosen ECA to spend many of her volunteer hours. So moving forward, I would just like to turn this over to Frances, and we'll have our Q&A at the very end. So please put your questions in the Q&A box.
Thanks, Jerry. I'm delighted to be here with you. Let me share my screen and get the slideshow going so I can see things a little bit better. I want to talk to you all a little bit today about climate change and how it affects our health. Because as a physician, I know that climate change is one of the greatest threats to our health. And as an active member of ECA, I was delighted to get the opportunity to talk with you all about the connections between climate and health, and help to empower you to improve the health of your community and to work for your climate and your health. So we can improve both of those simultaneously. Now, NASA said that we had the last 5 years were the 5 hottest years on record. That's because they made that slide last year. We now can say that the last 6 years are the 6th hottest years on record. And it looks like this is going to be the 7th. It really hasn't changed. So we know this is a problem that's been long in the making. We also know it's a problem made by human beings. There's something appealing about the idea that it's the sun or something like that. But really, I think I'm glad it's actually caused by humans, because if humans cause it, humans can change it. I can't do much about the sun or about the orbit of the earth, but we together can do a lot about what human beings are doing to the climate. And we know a lot of where those problems come from. They primarily come from our burning of fossil fuels. Not all of it, but that is by far the biggest part. And we do that to get from place to place, to fuel our industrial processes that make all the things that we use, the places that we live and that we work and we shop, to provide electricity, which we're all using at the moment, and the agriculture that produces the food that we eat. And that has a huge effect on our health. And that's something that healthcare professionals are becoming much more aware of. The Lancet is one of the world's leading medical journals. And several years ago, they became very concerned about climate change and health, and very concerned about their role as one of the world's leading medical journals to really alert people to that and help them understand that and help healthcare move forward. This is a quote from their 2018 Lancet Countdown by Dr. Salas. "Climate change is a medical emergency." I've heard other physicians compare it to working in the intensive care unit, and nature is their patient and nature is in critical condition. And many health organizations have agreed. I went to training back in January on how to do these presentations with Physicians for Social Responsibility and with Climate for Health. But there are many, many other organizations involved in working in this, including ones we tend to think of as rather staid and conservative, like the American Medical Association. And they really are realizing how urgent this is and issuing a call to action to solve this crisis before it's too late. So how does this impact health? I mean, I have a t-shirt that says climate change is everything. And that's true. And all of those things probably affect health. We can look at least a few of those impacts. This is a graphic from the Lancet Countdown, looking at what's changing with the climate: increasing temperatures, more extreme weather, rising seas, extremes of precipitation. And how does that affect us? It exposes us to a number of things that are not good for human health: extreme heat, air pollution, contaminated water, changes in vector ecology. We'll get to that because that sounds a little bit strange. What in the heck is that? Increasing allergens, changes in what we eat and what's available to us, and population displacement. We're already seeing climate refugees, and that's something that's likely to increase during the future. And being a refugee is very difficult for your health in many, many ways. So what kind of health outcomes do we get from that? Some of them are pretty obvious, like you might get a heat stroke. Your lungs might have a really tough time. If your lungs have a tough time, your heart will probably have a tough time. But so might your gastrointestinal tract, which we don't think of as clearly affected. We might get various diseases. It might affect our mental health. Sad to say, it might even affect children yet unborn. For people who are hoping to have grandchildren soon, that's a real concern. And then there's also the possibility of physical trauma and death. So sounds pretty grim. Look at some of these things in a little bit more detail. The Union of Concerned Scientists says that probably the biggest single threat we will face in the United States is excessive heat. It may be hot enough that the heat will literally go off the charts. The National Weather Service has a chart that creates the heat index. If you listen to the weather report or you look at your phone, it will tell you about the heat index, which is computed from how hot it is and how humid it is, because the more humid it is, the more the heat affects us. And it's getting to the point where we're starting to see days that are off the chart. That the National Weather Service, when they put those charts together, and they put pretty extreme weather on that, didn't go that far. Now, right now, there's only one area in the United States that has that problem, the Sonoran Desert near the Mexican border, and only a couple of days a year. But if we don't do something to stop the rise in temperature or slow it down significantly, it's going to become a much more common problem. And it's a problem that's really already here. We hear people talk about what's going to happen with the climate in 50 years or 100 years, and that's important. But it's even more important to realize it's not 50 or 100 years from now that it's going to start. It's already here. You may remember a couple of years ago, Montreal, Canada had a heat wave. It was above 100 degrees for several days. That's not something that normally happens in Montreal. And 70 people died. So it has already very serious effects, likely to become more common. These are the cities in the United States that are the most likely to be affected. And I've known people living in just about all of these places. And a lot of our members live in these places. This is not far away. Going along with this increase in temperature are changes in our air quality. Now, air quality isn't a climate change issue per se. It's not just that, well, it gets hotter, that makes the air worse, although it can play a role. But the fossil fuel burning that is driving much of our climate change is also driving most of our air quality problems. Burning those fossil fuels increases air pollution and warming, but it also harms our lungs, our heart, and it's particularly difficult for vulnerable populations like pregnant women. And there is some increase with global warming. Warmer temperatures are going to lead to higher concentrations of ground level ozone, and that's hard on people with asthma and other health conditions. Ozone can be a little confusing. People may remember the problem with the ozone layer. Basically, the idea is that ozone is good in its place. You want ozone way up high in the atmosphere. You don't want it down where you're going to breathe it. This ground level ozone is something you really don't want. And oil and gas development creates ozone smog with a lot of bad results. Children are missing 500,000 days of school each year related to asthma, and that plays a big role in that. And there are more than 600 respiratory related hospital admissions each summer. If you look at research from the Harvard School of Public Health, we're spending $187.5 billion in public health costs every year in the United States because of hazardous emissions for coal-fired power plants. That's looking at cancer, lung disease, and respiratory illness. Unfortunately, that's probably an underestimate. More recent research shows that basically every system in your body is potentially at risk from before you're born until the time you die. That air pollution increases the risk of miscarriages and low birth weight. A low birth weight for an infant can cause problems that may follow them throughout their lives. And it affects us in all kinds of different ways. It hadn't occurred to me until I was reading up on this that it makes you more likely to have acne as a teenager, as if teenage years were not bad enough. If you're still worried about your appearance when you're older, skin aging is more of a problem with air pollution. But more seriously, there are problems like dementia that are related to air pollution. That's the bad news, and it's pretty bad. But there's a flip side good news to this. We know that if we do everything we can to decrease greenhouse gas emissions and fight global warming, it will take decades for us to start to see the planet beginning to cool and get back to its previous level. Air pollution changes much more quickly than that. If we do what we need to do to decrease and then stop the burning of fossil fuels and decrease other sources of air pollution, the changes in health will be much faster and they'll be remarkable. Now, one thing pushing back in the other direction is fire and smoke. Probably you all remember what's been happening in recent years with fires, particularly in the American West, but the West is not the only place this happens. Fire seasons are getting longer and longer, and the most devastating fires are occurring much more frequently. And when you get those fires, you get an increase in particulate matter. That's one of the air pollutants that is the most dangerous, and it travels a lot. You can be miles and miles from the fire and still have that. Another problem is not nearly as obvious and dangerous, but it's one that I'm noticing a lot, and that's allergens. Like many people, I'm allergic to pollen. I love all the trees and flowers that come up in the spring. I don't love the pollen, and pollen is getting worse and worse. It's not just my imagination. There's quite a bit more of it out there. About 42% more than it was 10 years ago. I don't know if I'm sneezing 42% more, but it seems like at least it could be that. Not likely to kill me, but definitely noticeable, and definitely likely to get worse if we keep on our current path. That air pollution particularly affects vulnerable populations, and there are many vulnerable populations, but the ones that are most bothered by air pollution are people of color. Hispanic children are twice as likely to die from asthma as non-Hispanic whites. Black children are 4 times as likely to die from asthma as white children. Black adults are 3 times as likely to die. And African American women have the highest rate of asthma. It's a very, very common problem, and you can trace it back to where people live and where air pollution is the most concentrated. There's been a lot of research done on that, looking very specifically at neighborhoods and what happens. Now, one of the things we think about a lot when we think about climate change is extreme weather events. And this looks at extreme weather events that cost $1 billion in damage or more between 1980 and 2017. And obviously, we've got a lot more, and it's likely to keep going up for many reasons: droughts, floods, freezing, storms of all sorts, wildfires, lots of possibilities. But it seems kind of abstract, at least to me, when it's a bunch of pretty colored bars on a graph. It's not nearly as abstract when you look at something like Hurricane Maria. Hurricane Maria is the one that hit Puerto Rico. 100% of the residents lost power. Only half of them had electric power for 2 months afterward. I mean, think about it for a moment. Imagine having no power in your home for 2 months and what that would be like. They also had less access to clean water, and food was harder to get. The official death toll was only 64 people, but a more recent analysis showed over 4,600 people died. And it didn't just affect people in Puerto Rico itself. 8% of the medicines consumed by Americans are manufactured in Puerto Rico. And there were significant shortages of certain medications and supplies, particularly intravenous fluids, the ones that they give you in the hospital if you're dehydrated or bleeding or need something for extra medication. Also, many medical devices are made in Puerto Rico without other sources, including pacemakers. And 6 months later, there still was a lack of electricity and clean drinking water. And that goes back to a lot of our concerns about environmental justice, that people in Puerto Rico are American citizens, but certainly couldn't tell that from how we responded to the crisis. Now, hurricanes are a common cause of flooding, but there are many other ways that flooding can occur. And when you start getting floods and heavy rainfall, start looking at problems with waterborne diseases, diseases that come along because the water is contaminated. We tend to think of that as a third world problem, and it's a huge problem in many developing countries, but it can easily become a problem in the United States when our sewage systems and treatment systems can become overwhelmed and when flooding puts water everywhere. There are many waterborne diseases from bacteria, from viruses, from protozoa, and they're becoming more and more common. Now, the flip side of that is drought. You would hope you only got one or the other, but unfortunately, some places will get drought, some places will get floods, and some people will be unfortunate enough to get both at different times. There are many things that droughts can do to our health. They can certainly decrease agricultural production, which is a problem for our nutrition, also a problem for the farm families who have to deal with that. But when you have drought, you get dust. You get dust storms. That can make respiratory illnesses much worse. Those of you who live in the Southwest may be familiar with valley fever. Valley fever is a really horrid fungal infection that's becoming much, much more widespread with drought in various areas. Drought can also increase the concentration of toxic chemicals in the water. So if you have water pollution, you get more water pollution. And it can also give you toxic algae, which can cause many different problems. Then there's the problem of vector-borne diseases. Some of you may have heard the kind of trick question, what is the most dangerous animal? Well, if you hear that without any context, you're probably going to go lions or tigers or bears. But it's actually the mosquito. Mosquitoes cause more deaths of human beings worldwide than any other animal. Mosquitoes are only one type of insect that is what physicians refer to as a vector, an insect that carries disease to human beings. Mosquitoes carry malaria, Zika, and many other infections. I remember first learning about Zika. Zika just appeared from an American physician's point of view out of nowhere a few years ago. And we're going to see more and more of that. But it's not just mosquitoes, ticks and fleas. Also, you're seeing expanded range. Oops. They also get more days to reproduce. If it's warmer, they get a longer life cycle. They can have more baby mosquitoes, ticks, and fleas because they have a faster reproductive rate. And also, those little critters incubate faster. These are cold-blooded creatures. They like the hot weather. And increased metabolism. Increased metabolism, guess what? Gotta bite more humans so you can get more food. And Lyme disease is a fine example of this. When Lyme disease was first described, got the name Lyme disease because you found it in Lyme, Connecticut. It was something that's a little teeny place and wasn't very widespread, kind of odd. And over time, it's increased tremendously in its range. Lyme disease carrying ticks are now found in half of all US counties. And we have over double the cases in 2017 that we had in 1997. So that's a real concern for many people. I mean, should you let your little kids play outside if there might be ticks and those ticks might carry Lyme? Another concern is food and nutrition. That's something we've been relatively insulated against so far. But we have worldwide a growing population, and we have concerns about how much food we're going to be able to grow. Some people say, oh, CO2, it's plant food. It's not that simple. Plants need water, they need ideal growing conditions, temperature makes a difference. Wheat, which is one of our most important crops. If you increase the temperature, guess what? You decrease the yield. 1.8 degrees Fahrenheit, pretty small temperature change, can decrease wheat yields by about 20%. And for every day that it's hot, corn yields decrease. But it's not just that the amount of food decreases. Increased CO2 also can lead to decrease in protein and other essential minerals in our crops, so that the food that we do get is not as nutritious as what we're used to. Also, food coming from the oceans is a problem. Some of us think of seafood as kind of a luxury or an extra. For many people in the world, it's the basis of their diet. And it's a really valuable source of food. And you can see as ocean heat goes up over time, seafood is going to become more and more of an issue. It's partly heat. It's also partly what they call ocean acidification. CO2, when it dissolves in water, makes the water more acidic. More CO2 in the atmosphere, more CO2 dissolves in the water. Our oceans are becoming more and more acidic. That's particularly hard on shellfish because it tends to dissolve their shells. I mean, you can imagine if you're a shellfish, you wouldn't really like this too much. So populations go down. If you live in an area like I do in Maryland, where things like oyster fishing are a big deal, that's a significant problem. One thing we haven't looked at as much until recently is mental health. And I think COVID-19 has given us a little bit more focus on that. But looking at climate change, there are both immediate and long-term impacts on our environment, which leads to impacts on our society that can change us in many different ways. If you look at something that's just happened, like a hurricane, a flood, whatever, maybe trauma and shock, frequently there's aggression and violence that follows after that. All sorts of stressors. That stress affects our physical health, causes our physical health, are not great for our mental health, and it can really strain our relationships. Over time, you're looking at things like post-traumatic stress disorder, and a whole variety of mental health problems. We're hearing a lot more now about eco-anxiety, particularly in children. You know, knowing what's going to happen or what might happen, how do we cope with that? How do we deal with the anxiety? Do we deny it all? Do we put our heads in the sand? What do we do? There also are impacts on our community and our society. There may be a decreased sense of cohesion, that we're all in this together, that we all belong. There may be increased aggression. You've probably known when you're a little kid, since you're a little kid, that when it gets too hot, people get cranky. Well, cranky is not just, sometimes wanting to go off by yourself or saying something obnoxious to somebody. We know that there are increased rates of aggression, domestic violence, and other types of violent crime. We don't know exactly why that is, but at least part of that is changes in brain chemistry that occur as temperatures go up. And it can also lead to violence between groups of people, and political conflicts, and even wars, particularly when you have issues over conflict over resources like water, or you have groups of people like climate refugees who are on the move. They're particularly vulnerable populations, but there are many vulnerable populations. We all are in this together. There is no one who is immune to the effects of climate change. Some of us are more at risk than others. Certainly low-income communities and communities of color, but also children and the elderly. So all of us and our grandchildren are particularly vulnerable. Now, when I first started planning this talk, I didn't plan to say anything about COVID-19, but right now, talking about health and not talking about COVID-19 is like having a long discussion in your living room and not mentioning the elephant that happens to be in there. So COVID-19 is not due to climate change. There is no evidence for that. We don't know yet how weather will change COVID-19. There's some hope that it may be like the seasonal flu, that we may have a lower rate of infection in hot weather, lots of sunshine, maybe higher humidity. And there's some evidence that that might help some, although it looks like so far, and everything we know about COVID right now, because it is so new, is very tentative. But it looks so far like that's going to be a relatively small effect. If we look at where the infection comes from, where pandemics come from, they don't come specifically from climate change, but they have some roots in common. One of the roots of climate change beyond our use of fossil fuels is the degree to which we have transformed the natural world, the amount of wildlife habitat and natural land that we have converted to other uses, sometimes well, sometimes not so well. That puts humans and animals into contact they'd never had before. If you look at infectious illnesses, about 70% of them are what they call zoonotic. Zoonotic means they come from animals. That doesn't mean you should get rid of your dog or your cat, but there are a whole lot more animals in the world than there are humans. And there are lots of viruses out there that only affect bats or only affect pangolins or whatever, and don't affect humans. That doesn't mean they can't make the jump. And one thing that people who study pandemics have been worried about for several years is are viruses jumping from humans to animals, particularly coronaviruses from animals like bats going to humans, which is what it looks like happened with COVID-19, although that's not certain yet. That's certainly something that we need to think about going forward, is how do we need to interact with the natural world, not just to decrease problems with climate change, but also to preserve biodiversity and make it less likely that we will have a whole series of pandemics. Another thing that we know about COVID-19 is that it doesn't affect everybody equally. Some people have no symptoms at all. Some people fairly rapidly go from seeming okay to dying. Some people get very, very sick and recover. There are many, many factors in that, and it will take us years to figure that all out. But one thing that's becoming more and more clear is the role of air pollution in that. We know that 80% of people who died of COVID-19 in several European countries lived in the most polluted cities. We also know that looking at certain forms of pollution, like particularly fine particulates, tiny increase in what people have been exposed to over time can lead to a big difference in how likely it is they are to die. And that has many implications. It may be part of the reason that we're seeing more deaths in African-American populations, because African-American populations tend to live in places where they're more exposed to air pollution, particularly more exposed to those particulates. So there's much more to be learned about that, but that's kind of a snapshot of what we know so far. I want to shift gears from the bad to the good, because the solutions are at least as important as the problems. Hopefully all of you are at least a little bit familiar with Project Drawdown. It gives you 100 solutions to reverse global warming. It's not like you get to pick one and go with that. We probably need all 100, but it does give you a remarkable diversity. One of the things I like best about all these solutions is that for most of them, there are multiple benefits besides what they do for climate change. Not that what they do for climate change isn't important, it's extremely important, but they do many good things, and particularly they do good things for health. And we can talk about 3 kinds of solutions: mitigation, resilience, and restoration. Resilience is basically preparing for what's going to come and protecting ourselves against it. One of the things I think we've really learned from COVID-19 is we're not as resilient as we thought. You'd ask most people a year ago, is our health system ready for anything? Oh yes, we're ready for anything. Not. We're not even close. So we need to learn from that. And it's probably not just the health system. Probably all of these things and others need a much deeper look to be resilient against the problems that we're going to face. But that resilience can protect us. It protects people, it protects nature and communities. So it's extremely important. Now, mitigation is what we look at the most. I kind of dislike the word mitigation because it sounds like this little teensy kind of thing that isn't very important. Mitigation is huge. Mitigation is basically everything that we do to stop making such a huge mess out of the atmosphere and the environment, and to help move things back in the direction it needs to go. It's clean energy, energy efficiency, natural solutions, many other things. Clean energy has huge benefits on health. And smile the next time you see a solar panel on somebody's house, because switching from coal to solar can prevent 52,000 US premature deaths per year. And as I've said before, I think that's an underestimate. I think we can do even better than that. Clean energy also is good for the economy. It benefits employment. And employment is incredibly important for our health, particularly mental health, but for health in general. But to get those benefits working the way we need to make sure that we have a just transition. And that's something that ECA is really committed to working with our partners with to create, so that everyone can share these benefits. Now, one thing we don't talk about much because it's not very sexy is efficiency and energy conservation. I mean, you put solar panels on your roof and that's really cool. You caulk your windows and like, who even knows? But that energy efficiency is very important and happens in many different ways. And it has benefits that we don't necessarily think about. Certainly can benefit our pocketbooks. It can save us a lot of money, but it particularly is helpful for health. If you increase the energy efficiency of your house, you're probably going to do things that make your house a lot healthier and give you a much better indoor environment. Efficient transportation also has huge benefits for health. Now, some of it is just decreasing the crap in the air. A lot of the pollution that people are facing comes from things like diesel engines and shipping and freight. Making that more efficient has a huge benefit. Making vehicles electric helps a lot. Probably the biggest advantage from a health point of view is active transportation. Riding your bike, taking a walk. And it doesn't have to be all active, like public transit. How many people have a bus or a metro that comes up to their house and stops right in front of their door. Just about no one. You have to get there somewhere, some way. Bike or walking may be a great way to do that. And things like electric bikes. Electric assisted bikes, generally you pedal, and then the electric engine helps you when you need it. So that may make it possible for you to go places that you never otherwise would go on your own power, or mostly on your own power. So lots and lots of benefits from that. And it really helps to strengthen our communities and make them more livable, which has tremendous health benefits. There are lots of natural solutions that we also need to make part of this mix, not just decreasing fossil fuels, although that's probably the biggest thing we need to do and the one we focus on the most. And there are opportunities for that in every state in the nation, although if you're in Texas, this should be your thing, at least from this map. The darker the green, the better your chances. And it benefits many things, including our physical and mental health. Lots of different ways it can do that. One of the big things is looking at preserving and restoring nature. Restoration is putting things back to how they were before the industrial era, or at least closer to that. Basically natural solutions. So we're restoring wild nature and ecosystems, improving agriculture, planting trees where they used to be, and in some places planting new trees. And also preserving what's already there. It doesn't do much good to cut down a rainforest and then go plant some trees someplace else. One thing we don't think about much is urban greening and green infrastructure. This has huge health benefits, and it's something that's easier for many of us to get involved with. Urban greening can be your sidewalk trees, lots of different things to make your city look a little more like that. And that has huge benefits in many ways. We know that spending time in nature is very helpful for people's mental health, and there's a new research literature growing up showing advantages for people's physical health. Many, many things, and also decreasing heat islands. So if you're in one of those cities that's likely to get very, very hot, maybe planting trees is going to be part of your solution. One thing that's a little easier to do, something that all of us can do, is eating a plant-rich diet. Now that doesn't necessarily mean you have to become a vegan. If you want to become a vegan, go for it. But just shifting the balance from a very meat-centered diet to one where plants are the star is much healthier for you. It's great for the planet, and it can be delicious. So lots and lots of benefits to those natural solutions. If you want to learn more about any of these things, there are a ton of resources. Here are a few of them. And if you're having trouble finding the answers to what you're looking for, well, hopefully we're going to talk about that in the next few minutes. But beyond that, I'm certainly happy to help you with that. Because it's really important to be involved. We know that humans are much healthier and happier when they're taking positive action to solve with the problem or to actively cope with the problem. So as Gandhi said, be the change you want to see in the world. You can learn more about climate change and solutions, which you're already doing. Find some changes to make in your own life, and they can be small. It might be a meatless Monday, or getting some new light bulbs. Anything that gets you a start. Talking with your friends and your family can be one of the most important things to do, but also being an advocate and joining with others to create positive change. It's hard to do much on your own. This is a huge global problem. Francis Saves the World is not going to get very far. Francis and a few million other people save the world, that's a lot more plausible. Now you don't have to have a few million of them all together. Starting with the people in your ECA chapter, your church, your neighborhood, can be a great place to start, and also can help you build the social connections that are so important for human health. And whatever else you do, it's an election year, it's an historic, extraordinarily important election year, vote. ECA and our parent organization, Elders Action, we're all working on making it safe for people to vote, and that's extremely important. And working with many other people on that. So thank you, and I'd love to try to answer any questions that you have.
Thank you so much, Frances. That was wonderful and really informative. There's a lot of information packed into that. We do have some questions, the first one is, do you think the viral crisis is a combination of particulate pollution and the coronavirus, and that it's a primarily hypoxia, not a respiratory illness?
There's a lot we don't know about COVID-19 yet. I think it's primarily a respiratory illness, although we're seeing problems in the nervous system, in people's hearts, in their kidneys, throughout the body. There's even a syndrome in children called COVID toe, where they inflammation of a toe. So there's a lot we don't know yet. We don't know how much of that is the virus itself and how much of that is the body's desperate attempt to fight off the virus. But I think definitely the virus is the biggest piece of that. Air pollution, definitely particulates, but there's also data on nitrogen dioxide, and there are probably other pollutants that haven't been studied yet, are very important. And there are probably other things that we just haven't put together yet.
Thank you. A little similar kind of vein. Have we learned any lessons from the COVID crisis that we can apply to the climate crisis, and which actions might have the greatest return on impact in Alaska?
I think, for the first part, there are probably many lessons we can learn, but the one that's the most vivid to me, and I think maybe the most important, is early action is important. Like, there was a recent study from Columbia saying if we had started social distancing in the United States a week earlier, we probably would have saved about 36,000 people. When you get behind, it's very, very difficult to make that up. And in many ways, climate change is similar to COVID-19 or to any infectious disease in that. So action 50 years from now is certainly better than no action at all. Action 50 years ago would have been wonderful, but since we can't do that, really the time is now. And the faster we act, the better things will be. And that's true of COVID-19. That's true of climate change. That's true of a number of other things that we face. As far as things in Alaska, it's been a number of years since I've been to Alaska, so can't speak from personal experience. I know there are a lot of issues with things like permafrost thawing, and basically things are built on a foundation that's no longer solid. Also, a lot of communities near the water, particularly Native communities, are having to move. Some of this is just basically planning ahead. Some of the Native communities that are probably doing the best are ones that were able to get a little bit of a jump on this and to start the work toward moving ahead. Because it's very, very difficult to move a community, even a small one. The earlier you start, the better it's going to be. For permafrost, there's a huge engineering question there I can't begin to address, but it's extremely important. Other than those things, I think the solutions for them are pretty much the same as the solutions for us, that we need to find ways to decrease our use of fossil fuels as much as we can, to sequester carbon with natural solutions as best we can, and to take advantage of what's there. The last time I was in Alaska, or next to last time, was in Kodiak, where there's a Coast Guard support center. And at the time, they didn't have any renewable energy. They were using all diesel. And the diesel had to come in by boat. Everything in Kodiak has to come in by boat or by plane. That makes it very expensive. So several years after when I was there, people got sick of that. And they thought, what can we do? Well, solar is not going to work in the winter in Alaska, obviously. Kodiak's a big fishing port. It needs reliable electricity. But there's a lot of wind in Kodiak. So putting up wind turbines, and then they put up this humongous flywheel because the problem with wind is it it does what it wants to do. I think someone referred to the wind in Kodiak as a wild child. But this humongous flywheel allows them, basically it's a giant battery, and allows them to store the electricity that they need, so that now only a tiny percentage of electricity in Kodiak comes from diesel, and almost all of it comes from wind. So in Alaska and everywhere else, there are going to be local solutions that we really need to look at.
Thank you. Thank you. We have another couple of questions. This is, what about plastics? I'm assuming the question is really related to the plastic pollutions and their impact on health, and also the use of plastics impact on health.
Yeah. Plastic we could probably spend at least another hour on, but just to talk about it a little bit, it's something that we're learning a lot more about, particularly in terms of microplastics. In some ways, the climate crisis and plastics are closely related. The vast majority of plastics are made from fossil fuels. Most plastics are not effectively recycled. And when they break down, depending on where and how that happens, and to what extent it does, because they break down extraordinarily slowly, you may be getting more fossil fuel pollution from that. One big concern about plastics, and we don't know how much of an issue it is yet, is microplastics. That sometimes it seems like a big piece of plastic breaks down. Rather than going back to its chemical constituents, though, what it's doing is breaking up into microscopically small pieces. Those microscopically small pieces can go all sorts of places, including into your food. They go into your food, they can go into your gut, they can go various places into your body. Nobody can tell you what happens if you have a lot of microplastics in your body for 70 or 80 years, because that hasn't happened to anybody yet. But we can start to make some better predictions and try to figure that out. And certainly erring on the side of caution to use less plastics, to dispose of them responsibly when we do use them, to recycle them when we can, and to develop other better materials is really important. One problem we're seeing with COVID-19 is that because people are reasonably so worried about sanitation, people are using a lot of plastics they wouldn't have used before. Also, it's harder to recycle them. Plastic recycling at my organic market where I took everything has basically disappeared. Hopefully it'll come back.
Thank you. So Ross wants to know if you think that our health benefit from the viral shutdown come more from the social isolation or from the reduced pollution?
I think probably mostly from the reduced pollution. Clearly having less pollution helps, and you see a benefit from that pretty quickly. You're not going to see really a climate benefit from it on the time scale that we're looking at least the time scale I hope we're looking at, because we've been stuffing greenhouse gases into the air for so long that the reduction is pretty tiny, but it is enough to see a real reduction in the pollution that we're breathing. And that has health benefits on a much shorter time scale. Now, certainly there's some people who are probably better off being away from other people. Everybody knows people they're happy not to be associating with during the social distancing. But humans are social beings, and we really need each other. And there's a huge research literature on the problems of loneliness, and on the flip side, the benefits of social connection. And that's a big concern during the social distancing, is how do we keep people connected? So a lot of people who are the most vulnerable to COVID-19 are also the most vulnerable to social isolation.
Thank you. This is a little more of a comment, but I'll let you hear it anyway. And hasn't the way we're addressing COVID by listening to science and gathering data helped to flatten the curve? I hope we will do that when we get to go back to focusing on climate. COVID has also shown the world and everything on it are intimately connected, and we can no longer say that change isn't possible. We've just seen that we can change. The question I would have is that change sustainable
Mhm.
moving forward, when people want to move back into the world very, very quickly?
Yeah. 'Cause we have to give a lot of thought to how to make change sustainable and fair. A lot of people, are able to work at home, and it may be difficult for them, but it's doable. For the people who are growing our food, for the grocery store clerk, for the people who are cleaning rooms at a hospital, it's a whole different story. So making those changes sustainable and making them fair to everyone, I think we can do it, but it's not going to be anything resembling easy.
All right, let me see. I think we have another question here. A comment that on your Alaska statements, 90% of Alaska's state budget is from oil and gas revenue, and we do not still have much of most Alaska. We do not have much in most Alaska. Kodiak has decoded it with wind and hydro storage. So that goes to your comment about the wind turbines.
Yeah, that's it. Oil and gas, you've got the permanent fund in Alaska, and nobody who was getting a check every month wants to give that up, or almost nobody, and that's perfectly understandable. And the state of Alaska certainly doesn't want to give that up because they need the money, and that's one of many problems we have to come up with a better solution to.
Right. One more quick question here. Like Gandhi, do you think that civil disobedience will be necessary to raise awareness and public opinion? My hero is Francis Crowe, and I think that elders could be very effective. What are your thoughts?
I think it's a hard question. I think civil disobedience definitely has a place, but it has to be part of a larger strategy. Just getting aggravated and I'm going to go sit in front of something until they drag me away is probably not going to change anything. But if it's part of a well-planned, well-coordinated strategy, it could be very effective.
Great, thank you. I think that's all of the questions I see right now. Let's see. We've got some thank yous and wonderful presentation in the chat and in the Q&A box. So we thank you for that. It's been really informative, and we're very honored to have you speak to our elders in ECA. And we will be sending out the recording of this within the next few days. So you'll be able to rewatch it or watch it at your leisure sometime in the near future. And remember that we have our, these national calls are on the 4th Tuesday of the month at 7 o'clock. And we also have our Tea and Talk chats on the 2nd Tuesday of the month at 6 o'clock. And what else? We have our community conversations on Friday afternoons at 3 o'clock. All these times are Eastern times. You've received bulletins, and the newsletter will identify all those times for you. We've got some new security measures in Zoom, so things are changing a little bit. We're going to be registering for national calls moving forward because of the security in Zoom. And that's for your safety and ours, and so that we're not unpleasantly visited by somebody that we don't want to be with us at that moment. So we have a lot of comments. Brava. Thank you, Frances. Thank you. Fantastic presentation. So thank you. Got a lot of really good feedback here. And I'm going to leave you with, I hope you've enjoyed this presentation. I certainly have. And I intend to watch it again and really take in some of that data. It was a data-rich presentation, and very, very good data. So hopefully you've all enjoyed it. And if you've all enjoyed it, I hope that at some point in time in your life you might consider making a small donation to ECA. That's the only way we survive, is from our member donations. So please think about us, and I hope you all have a good week. Thank you so much, Frances. This has been wonderful. And to all of you, Have a good rest of the week.